Yeah, so what we did is we pulled together the data from 4 hospitals, one in Europe, three in Australia and New Zealand, that have been doing cardiac CT routinely in patients with acute ischemic stroke in the acute phase, so in the acute imaging protocol. And we combined all the data to see how often do we detect thrombi in these patients on cardiac CT. And overall, the proportion is around 6%, so a little higher, but around 6% of patients we find a cardiac thrombus, usually in the left atrial appendage. Sometimes it's in the left atrium, and in rare situations, in the left ventricle. So yeah, around 6%. What we find is that in certain patient groups, this proportion is higher. So, for instance, patients with atrial fibrillation, it's slightly higher. It's higher in patients with more severe strokes, with large vessel occlusions. So there's all kinds of ways to stratify the data. But if you take all ischemic stroke patients combined, it's around 6%. Now, this was the data of almost 4,000 patients. We also compared how well it behaves, cardiac CT, in detecting cardiac thrombi compared to the standard of care, which in most centers is TTE, so transthoracic echocardiography. Now, this wasn't available for all patients. It was only routinely done in 1/3 of patients, which is low, but it also shows the problem of routine TTE. It simply is not done in every patient. That's a consistent thing that we're seeing in other centers as well. But still, we have data of around 1,300 patients that underwent both cardiac CT and TTE. And if you compare those, you can see that the detection rate of cardiac CT to find cardiac thrombi is around 7 times higher compared to TTE.